Well, Singapore has started testing around 30,000 residents and staff in residential care homes to better protect the elderly. Li Lieng joins us with the details right now. So tell us more about the measures put in place to protect the elderly staying in these residential care facilities, Li Lieng.
Well, all 16,000 seniors as well as 9,000 staff working across 80 nursing homes in Singapore will be swabbed to try to pick up any COVID-19 cases early. Now, at this point, they have already picked up one case of infection from a staff working at Wen Tsi Hospital. His close contacts have been tested, and they have all currently tested negative, and they are currently being monitored for any symptoms of COVID-19 right now. Now, testing for those in nursing homes are expected to be done by June. Now, the same measures are being put in place by homes run by the Social and Family Development Ministry, and these include places like sheltered homes and adult disability homes. Now, there are a total of 4,600 staff and residents there, and the testing there is expected to be done by next week. So far, all of them have been cleared of the virus. Staff who work and interact closely with these elderly clients, arrangements are currently being made for them to stay on site at designated quarters or in hotels. Now, this is so they don't bring any potential infection back to their families or spread it to the wider community. Now, staff will be on these arrangements till the end of circuit breaker, and the government will foot the bill for the stay in the hotels. Now, these additional precautions are important because we know that COVID-19 affects the elderly more severely. Now, in fact, in Singapore, of the 20 deaths that we have had, 4 were nursing home residents.
Seniors in the community, as well as seniors in our residential facilities, are most at risk because if infected with COVID-19, they tend to fare poorly. We've therefore been paying extra attention to seniors because of this higher risk of developing serious health complications if infected. And it is therefore important for seniors to try to stay home as much as possible.
Li Lieng, there are some healthcare staff who have been diagnosed with COVID-19. What's being done to ensure safety of workers and volunteers?
Well, this is an issue health authorities are concerned about, and currently investigations are ongoing to see if these cases were infected because of interactions with patients or fellow staff members. Now, let's not forget, it's not just healthcare workers on the front lines at these dormitories and community care facilities. Now, there are also security personnel, cleaners, or administrators who have to go in and out of these facilities. So refresher training is being conducted so they know how to properly use their masks or personal protective equipment. And while those working at these facilities may be conscious of safety protocols while they are working with patients or migrant workers, they are now being reminded to be vigilant even when they are taking their breaks. Now, this means abiding by safe distancing measures when they are having their lunch or their dinner, and physical barriers are currently installed at rest areas. Now, staff at these facilities are also tested on a regular basis to make sure they are not exposed to infection.
So what about the effectiveness of the circuit breaker measures then?
Well, the circuit breaker measures seem to be working at this point. Singapore has seen the number of cases in the broader community coming down, and the number of unlinked cases are also coming down. Health authorities know this because a smaller number of COVID-19 cases have been picked up from a surveillance program that tests for those with prolonged respiratory symptoms. Now, today the task force also announced an easing of another restriction during the circuit breaker measure. Now, from May 12th, traditional Chinese medicine halls with no registered practitioners will be allowed to sell medical products. Previously, only those with a registered practitioner were allowed to do so. Now, they will have to put in place necessary safe distancing measures to keep the elderly safe. The task force was also keen to stress that while these restrictions have been relaxed slightly, people still need to remain vigilant because Singapore is still fighting the virus.
All right, thanks for that update, Li Lieng, speaking to us.